Okay, so what we're going to do now is go through the class activity. We're going to look at gingivitis as a condition. What I've done is I've just used the sample case study sheet that you have been given as a template. Now, you don't have to work with that template. But let's just talk through it. So the first thing we're going to look at is the condition. So in this case, we're going to look at gingivitis, which is inflammation of the gums. And what I'm looking for here is your understanding from your readings and your research that you understand what the condition is. And in this case, common mild form of gum disease that can lead on to severe periodontal disease. It causes irritation, redness, inflammation of the gums, perhaps bleeding. A common cause is poor hygiene, and good oral habits may actually help prevent it. We know there are two main groups, plaque-induced and non-plaque-induced gingival diseases. So this isn't really a lesson about gingivitis, but it's just demonstrating to you what I would like to see in your case studies. And you explain that. And please also provide the reference here. And, you know, that this may well be the reference to the Merck online that I have given you as a link, as well as maybe your bone Mills and online, and a full reference according to the college guidelines, please. That can just be on the bottom, so you can just do Merck is your reference one, and you just provide a bibliography at the end. The clinical features, I've just made up a clinical feature here. Bob Miller, he's 35, he's a smoker. He's got sore gums that feel a bit spongy, there's some bleeding when he's cleaning his teeth. He doesn't floss regularly. He travels a lot for work and he eats a lot of takeaway and drinks lots of soda water. So classic case of a smoker. It's obviously having an effect on his gums. He's 35. He needs to address it. So we look at the etiology. Now the etiology is the underlying. I have given you some information on it. Please read it. You need to know the difference between etiology and the manifestation. So in this case, there are non-plaque-induced gingival disease, and they might be caused by bacterial, viral and fungal infections, genetic disorders, or other diseases such as lichen planus, which is fungus. Aggressive tooth brushing, allergic reactions are others. Then you have your plaque-induced. This can often be the immune response to the plaque. Could be redness, swelling and bleeding. It could be genetics. I think the numbers, the last time I looked, were I think 19% of the worldwide population suffer from periodontal conditions or disease. Malnutrition. And obviously, because Bob has a poor diet, we need to have a look at his nutritional deficiencies. So sometimes a good vitamin C or a multi might help. So we need to assess his oral hygiene. When you look at your non-pharmacological measures, does he wear dentures? Send off to the dentist. Make sure he's taking good bioflavonoids. You can use a mouthwash. Make sure his diet is good. He can do some gum massaging. And what we're looking at here, I would say with Bob, he could quite possibly have both courses, but you know, we could definitely say he's certainly got the non-plaque induced, simply because he's not been very good with his hygiene. And possibly malnourished. So then you look at your herb table. Now in your templates, I've given you a rationale template as well, and that's really to help with your thought process. That's not essential for you to hand in, but it's useful for you to keep on record. So in this particular case, along the top, we've got our classes in the herbs. So here you want to, by using your template for rationale, you're going to work out what you actually want. What do you want to treat first? In this case, it would be, well, we want to make sure that the redness and the inflammation goes down. We need a vulnerary to help heal. So we would put those along the top. We might say, right, we want to work on microcirculation. So we'll have a vulnerary. We probably need an antifungal in there. You know, overall probably could do with a little bit of liver help, but we just need probably a little mini hepatic, possibly. We definitely want a demulcent, something that's really going to soothe his gums, so his gums down. We need an astringent, and we want an anti-inflammatory, antimicrobial, specifically indicated. These are herbs that have been used from the BHP, and they have specific indications. And we may want some immune enhancement. So you can see here we've got our myrrh. We've got, this came from the rationale. It's antifungal, antimicrobial, it's astringent, it's antiseptic, it's anti-inflammatory. We don't really need its expectorant effects here, although he does smoke, so it might help. It's also a vulnerary. We're actually here making up a mouthwash. This is really going to be used for external, not internal. And Hydrastis, of course, our good old golden seal. Now, in theory, Hydrastis is a medium dose herb, but I do use it in low doses simply because there are other herbs like berberis that we can use for the berberine content. It is a very expensive herb, but it's highly effective even at low dosages, certainly with this mouthwash. Salvia, sage, is actually a specific indication for mouth infections and gingivitis, so we put our little cross there. And by the way, as we work those out, we put our little crosses in here. So and what we're doing here is working out that we have ticks in all the boxes. Okay. It's also antifungal. So Hydrastis, you're ticking the boxes there. So salvia, we've got that anti-inflammatory, astringent, antiseptic. It is also demulcent. Centella gotricola, well, this is one of the most amazing microcirculatory herbs. It heals, it works on connective tissue, so although we don't need it as a brain tonic, we do want it for its vulnerary effect, and it is an amazing microcirculatory herb. That isn't strictly a class here, but it's one that, you know, it's a peripheral vasodilator, so you can pop it into that class. And thyme is a really good, of course, antiseptic, antimicrobial. It is quite strong. You could replace this with bilberry or something like that. Oh, sorry, we do have bilberry in here as well, Vaccinium. This is also an amazing, this has your flavonoids, vitamin C, anthocyanidins, then, you know, very important for that microcirculatory support. So basically, you might tick at the bottom how many crosses they've got, 4, 5, and depending on your main action, you will decide at the bottom how many you think would be most important. So how many of the herbs do you want to have an anti-inflammatory effect? In fact, most of these have that anti-inflammatory effect. So probably in this case, we're going to be ticking all 5 of them. So here are herbal formulation. This is where we're looking at our 1 in 5s, 1 in 3, 1 in 2, 1 in 2, 1 in 2, 1 in 2. And this is really going to dictate its efficacy. So here we've got Commiphora murmur. That is categorized as a low dose herb. 1 in 5. You could do between 5 and 10. I'm using 10 here because I really want this to have its resin effect, and it's not actually going to be ingested. It wouldn't matter if it is, but it's not going to be. In this case, we're going to use it as a mouthwash that the client can actually, so the dosage is going to be perhaps 5 ml in warm water after brushing teeth at night, and then 5 ml warm water before brushing teeth in the morning. Now, note, myrrh may cause some discoloration of the teeth. This is temporary, which is why I suggest using it before brushing teeth in the morning. Perhaps hold in mouth in shower, while showering. What we're really looking for is them to keep it in their mouth for as long as possible, at least 10 minutes, and pulling it through the gums. This is an absolutely amazing herbal formulation, by the way, for anyone you know that might have gingivitis or periodontal disease. So we're now looking for 100 mils. So 10, 15, 20, 40, 65, 75, 100. Okay, and here we take the italics off. We only need italics for the botanical name, so we can take those off. Contraindications, well, here it's fairly safe. I don't see any here, but it was up to you to make sure they're detailed. And then I obviously like the references at the bottom. The main thing we're looking at is safety. So here as well, non-pharmacologically, we could look at something like address smoking, provide good takeaway recommendations, and perhaps assess blood pathology if they have any, or send him back to the GP. So, you know, this condition can be a long-term issue. And lastly, what I really wanted to show you here, if I can find it, you have provided the Nature Care dosage chart. Now this was put together some time ago, I'm not sure who by, but it does detail all of the herbs, and it gives you the normal dosages. You can see here propolis. Propolis is very resinous, and basically is a 1 in 10 herb. It's obviously a byproduct of bees, and it's between 20 and 40. So even though it's a very resinous herb and it's 1 in 10, it's 20 to 40 because it's already been diluted down quite significantly. Then we also need to look at our scheduled herbs, and there's a few that fall into the Schedule 4, and obviously here the digitalis is the main one, or digitalis purpura is the one we use. Ephedra is Schedule 4, lobelia is Schedule 4, and then you've got your Appendix C, which can be used basically topically. Then of course we've got our herbs that are endangered as wildcrafted. So bearberry uva ursi has recently become increasingly endangered. Hydrastis, you would know, that is now commercially grown. Picoriza is a beautiful, beautiful herb, and that unfortunately you will see a lot of research in your notes on picoriza, but please don't include it in your case studies because we just can't get hold of it. We can get hold of Panax. I use it very judiciously. The same with slippery elm. The slippery elm's a problem because it requires the whole bark, so the tree obviously has to be destroyed in most cases. So I think that is almost it, apart from you have been given this MediHerb liquid dosage index chart. It is up there on your Moodle, and this will give you a really good, this only came out a year and a half ago. It gives you really good dosages and rationales and updated research dosages. So if we go to Devil's Claw, if I can find it, under D, here you go. You'll see here Harpicavitum, a 1 in 2, and it's basically a 40 to 80 weekly dosage. So have a look at that and see if you have any queries and come back to me. You can see here licorice high grade is a 1 in 1. And this is where it's been standardized, and the ethanol extract is at 20, and you can see the 1 in 1 here. Normally, if that was a 1 in 2, that would be your licorice at 80 mils. Don't be scared of licorice. It's only a real issue for very few people. The high grade, you can see here, really makes it come down to a 10 in 30. So I hope this has clarified some of the confusion, and I'm sure we will actually be discussing a lot more over the next couple of weeks and over the rest of the term. Have a lovely Sunday. And I have to apologise for the quality of this video. It's something I've just had to do in my own time because I've become concerned that there's a little bit of confusion going on.